Well, research shows nurses working in psychiatric wards run a high risk of being exposed to aggression and violence from their patients. In addition, there aren't any guidelines on how to best react to these circumstances. Enduring such abuse has proven to have negative psychological effects for these health practitioners. And the University of Johannesburg did a study with practitioners working at a mental health facility for an uninterrupted period of 24 months. So to discuss this further, we're joined via Skype by Professor Marie Poggenpoel, who is one of the co-authors of this research. Professor, thanks very much for being with us. Good to have you on Morning Live.
Thank you very much.
So this particular study and the look into the investigation and research, why did you decide to embark on it?
This specific study is about psychiatric nurses' experience of aggression and violence from their colleagues. We decided to do that because one of the authors noticed that there was quite a lot of aggression in this specific psychiatric hospital between psychiatric nurses as colleagues.
Yeah. So the kind of violence and aggression we're talking about, what exactly is it?
They experience no physical aggression. They experience verbal and non-verbal aggression. Verbal aggression like name calling, gossiping, telling stories, and non-verbal verbal behavior like isolating their colleagues, ignoring them. Now, this is actually more stressful for a person than physical violence because of the emotional stress and psychological challenges they experience.
Yeah, one can only imagine the effect that this actually has on health professionals. What were your findings? I mean, how does this affect them?
Oh, it makes them feel isolated and not valued as a person, not respected, and they start focusing on themselves and they're being miserable. So they're not able to totally focus on the patients in their care.
Yeah, you obviously understand that these patients are ill. I mean, they are mental patients.
Yes.
They are there, and I don't act this way on purpose. But the kind of psychological effects that this has on nurses, do they ever get help for it? And my next question to you, I'll ask you as well. I mean, if you want to include it in your answer, surely this has a long-term and a cumulative effect on the nurses.
Yes, it does. It makes them stay away from work. They're unhappy and frustrated. And of course, they carry this unhappiness over to their homes and their families. You also asked, has something been done? In the same study, further down the line, in the second year, workshops were presented by Dr. Marisa Roots at this hospital, and psychiatric nurses found it very helpful. It was about self-awareness, self-management of stress, and how to cope with the aggression they experience.
Is there on-site help for the nurses?
I'm not sure. They experienced that they got no assistance or help from management.
Yeah, and that's very, very hard because, I mean, having to work in an exceptionally stressful environment and yet have no one to turn to because, as you've already mentioned in the research, that you found that the environment is toxic. It's a dysfunctional nurse-to-nurse relationship as well, where there's further stress and aggression in the work environment between each other.
Yes, and that is really not helpful for nurses or any other person in the workplace.
Yeah. So your research that you've done, I mean, you did this for a period of 2 years, 24 months. What's going to happen? I mean, do you think that we'll see some intervention from the Department of Health to assist the nurses?
I think what has happened is other hospitals have noticed this, as general hospitals, and Dr. Marisa Roots have been implementing the workshops in different health settings with very positive effects.
What would the recommendations be? I'm not sure if the report looked into recommendations of how they can be helped, the nurses.
The recommendations included that there should be regular workshops for psychiatric nurses and other health professionals so that they would able to verbalize their unease and help them with self-management of aggression from colleagues and also from patients and other professional members of the team.
Yeah. I mean, do these nurses get special training to have to deal with patients that have this kind of mental disorder?
Oh, yes, they do have special training. But you must remember one thing, and people forget that psychiatric nurses are also human beings like people with mental health challenges. So it's also very important for them to be mentally healthy and alert and full of love and empathy, which they can't experience if they feel isolated and rejected and undervalued.
Yeah, I think this is a vitally important study, and you know, one can only imagine what it is like working in an environment where there just doesn't seem to be any support, whether from your colleagues, from the people you work with and try and help, and then of course you take that home as well. So thank you so much for talking to us. I hope that this report is taken very seriously and the recommendations are implemented. Professor Marie Poggenpoel talking to us about a research study that was done on how working nurses in psychiatric wards are exposed to aggression and violence from their patients and also from their colleagues. All right, we're going to take a break here on the program. We've got more for you after this. Do stay tuned to Morning Live.